Hello, 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 everybody. This is Irina Strunina, and this is our podcast, Diabetically Speaking with Smart Move 360. This is where we meet every Thursday at 4 p.m. Eastern Time, and I invite my guests to the conversation to talk about life with diabetes. And usually, I invite experts, people who work with patients who have this diagnosis. So this is why we call it this way, diabetically speaking. And the very last Thursday of the month, my guests are people who live with this diagnosis and they share their stories and they share their challenges, discoveries, aha moments. And it not, doesn't mean that all of them are already in a great numbers range and doing perfectly. But they have their challenges. Everybody has their challenges, and it could be not necessarily regarding involve the food. Sometimes it's emotional. Sometimes this is the work related, or maybe family situation. So diabetes is this omnidirectional. It could affect uh, your results from any unexpected source. So this is why it's so important, I believe it's so important to have a understanding that there are a lot of people who can help you, people who can educate you on certain area in life and how it may affect your blood sugar levels. And this is actually why I have today's guest, Chelsea. She entered our Facebook group, Diabetes 101 for Beginners, and started helping people, posting some information and answering some questions. And I thought, I need to speak with her. I need to find out what she's about. And I learned quite a bit. So, Chelsea, welcome. And please
Thank
introduce
you.
yourself. Tell us why you are doing what you're doing.
Yeah. So my name is Chelsea Hayman. I am a physician assistant and have been specializing in endocrinology over the last 8 years of my career. I've been a PA for about 10 years now. I started out within internal medicine, primary care, and then I eventually found myself in endocrinology, and it has truly become my passion. I absolutely love helping people with diabetes. I have been in the adult world in the outpatient setting in endocrinology office, and I did that for about 5 years. And currently, I'm working at a children's hospital, so managing kiddos' insulin while they are admitted to the hospital. And soon I'm going to be going back to the adult world into an outpatient endocrinology practice again. I do miss the patient provider relationships that I had with that career path. So I'm excited to get back to that. Um, I have a passion for helping and educating people with diabetes. So, diabetes is so overwhelming. It is often a diagnosis that just gets thrown at people and
Yeah.
they don't know what to do with that
Hmm.
information, and they don't know what that information necessarily means. A lot
Yes.
of times they're diagnosed by their primary care physician, they're given a meter, if that. Some people don't even get that, and a diagnosis and just sent on their way. So I just really want to help people feel empowered in their diagnosis and to help with educating. I want them to know what lifestyle strategies are available, what medication options are available, and what resources people have. As you've said before in our previous conversations, people don't realize that there is something called an endocrinologist. It doesn't have to
Yes.
be primary care that manages the diabetes. Find a specialist if you're not satisfied with your care or satisfied with the lack of education that you are receiving. So having an endocrinologist on board with your treatment team is super important, especially if your A1C is not where it needs to be. And with my passion with um, education, I have recently launched a new business. Because of my passion with education, I wanted to start a diabetes education course and one-on-one diabetes coaching for patients.
Mm-hmm.
Um, I have a big passion for helping women as well. So my company is Empowered Glucose and is targeted towards women with diabetes or insulin resistance that um, really need help, need that
Mm-hmm.
support, need education. It's not just about the education as well. I also want to focus on the emotional side of things and
Yes.
kind of help make people um, feel empowered, like I said, with their diagnosis and lessen the overwhelm and stigma related to having diabetes. So um, I recently launched that and should be up here soon.
All right. Well, thank you. Thank you, Chelsea, for giving us this overview. So I wanted to, for our listeners to know that there is help out there.
Mhm,
And the very often in our Facebook group, Diabetes 101 for Beginners, it's a big group. And a lot of times I mean, every day we hear the stories how people uh, go to the doctor for whatever reason. They had regular annual physical, or maybe they had headaches for several months and they didn't know what's going on, or maybe one of their wounds wouldn't heal well. They go to the doctor, doctor looks at that, listens to them, draws the blood. 2 days later they get the phone call or the email saying your blood work showed you have diabetes, and we need to schedule the follow-up blood work in 3 months. This is it. This is how
mhm,
much information a lot of people get. And I can talk about it for a long time because there
mhm,
obviously not only one reason for it. There are multiple of reasons for this. And sometimes I think in most of the cases, this is such an emotional diagnosis because a lot of
mhm,
us, we've heard those stories about how bad diabetes could affect your health. And people get scared, people get depressed, people throw the throw the towel because they say that this is it, my life is over. My mission is to let everybody know that, well, whatever you did before that, whatever happened to you in your life before that, it's over. You already crossed that path. You are now here and now. And looking forward, you know what you have.
mhm,
You also must know that people live long, successful, productive, happy lives with
mhm,
that diagnosis. The key is know what it is and know how to manage, control it, and avoid the complications, avoid the different situations when you got to go to emergency room or something like that. So unfortunately, this is the diagnosis that once received you have to live with, but with the good, proper education, knowing who you need to speak with if you have a
mhm,
problem, and have some sort of a system already worked out because nobody but you will know your body better. Doctors may
mhm,
test you, doctor may suggest you different paths, but you got to try it and see if that works for you. If your body responds the way how is predicted by the doctor. Maybe you have, as we know, sometimes people discover other diagnoses because of diabetes, and much more serious diagnosis than diabetes because their response was not the way how it was expected. So let's just stay with that. Diabetes is not a life sentence. It's a diagnosis that you could manage. It's much better diagnosis to manage than say cardiovascular or asthma or anything like that because you can measure it. You could measure it right away with the poking your finger and reading the numbers, while with the say with cardiovascular disease you some challenges may creep on you and you don't know it until it hits and you fall unconscious. So with that, I believe that endocrinologist is the, well, it's not that I believe, we know that endocrinologist, the expert, the doctor, the specialist who specializes specifically on this diagnosis. And unfortunately, a lot of times, doctors, the PCPs, um, not referring people to endocrinologists for consultations. Maybe because they think that this person has a mild version and they could do it and they don't need to go to
Mhm.
endocrinologist. Or sometimes it is challenging to get to endocrinologist because they are there are fewer of them and their
Mhm.
schedule is very busy and people have to wait for several months to see one. So sometimes people just like I don't know. And but at the same time we hear those stories when people say, "Oh, I tried that and my doctor put me on this and we tried that and this diet and this exercise and this and that and nothing helped." I am I exhausted all my resources, and people in the Facebook group will ask him, "Did you go to endocrinologist?" And to much to our surprise, it's like, "Who is that?" So
Mhm.
obviously, not all resources were exhausted, and probably the expert who can help you is still one of your hopes. Go there, schedule the appointment. So, Chelsea, how often in the practice, when you were working with the adults, I mean, hospital
Mhm.
setting, we understand this is emergency situation and
Sure.
it's different. But when you were working in the adult setting where you're going again, how often did you see the people who had no idea why they're meeting with endocrinologists?
That happens a lot, honestly. A lot of people are just, they don't have the education and the concept around what their diagnosis is and how bad it is, and how bad it can be. So a lot of people are show up and they don't necessarily know why they're there, why their primary care sent them. And also to that note, primary cares are great. They can manage initially, but they, being in primary care myself, they have just a base knowledge of everything. And the specialists like endocrinology really have that depth of knowledge that primary cares can be lacking. And also, primary cares are very busy, and there's not enough time to educate, not to fault of their own, because a lot of healthcare nowadays is really cranking out the patients, and there's limited time with the patients.
Yes.
So it's super important to go to a specialist, like endocrinology. If you do have a diagnosis of diabetes, there are lots of resources within an endocrinologist's office, like diabetes educators and dietitians that can really support and educate you.
Absolutely. You know, the sad story that my husband, when he got diagnosed, he was going to see his primary care for years, for years. And then only on the 11th year being diagnosed, his kidneys, this was a complication from the flu because the immune system in the body is already weakened. So he contracted the flu, and one of the unfortunate um complications after that was the kidney failure. And
Mhm.
only then we learned about endocrinology. I thought I was reasonably well educated in medicine. It's
Mhm.
just public self education, nothing special, never specialized in anything. But for whatever reason, even I had very little knowledge about endocrinologists.
Mhm.
My husband even less. So, and unfortunately, this situation happens so often. So, what
Mhm.
is, you just already said a little bit that going to see endocrinologist, you have more resources. What else is different between the regular visit to primary care and visit with the endocrinologist? What else they can help people with? And one question I just heard, you said that endocrinologists have more time to see patients, more than 7 minutes.
Yeah, so there is a bit more time. Again, it depends on the practice, but I personally would have about 20 to 30 minutes with a patient and
Mm-hmm.
can really go into depth, review blood sugar logs or review blood sugar meters, continuous glucose monitors. And so I can uh, really have the time to look into that and kind of get to the bottom of what's going on. We also have more depth of knowledge, like I mentioned. So we are constantly being informed and educated on diabetes specifically. So we know of all the medications, the side effects, and everything that goes along with that. We go to diabetes conferences so that we can stay informed on medication and technology updates. Um,
Mm-hmm.
we usually have A1C. Again, it depends on the practice, but a lot of practices have A1C uh, machines where they can check an A1C right there in the office. We have ways to upload the technology to the chart. So we're able to review all of that. If patients are on insulin and need an insulin pump, we're able to start patients on insulin pump therapy. It's not necessarily just for type 1s, but
Uh-huh.
patients who have type 2 and on insulin injections can go on to an insulin pump. So we're able to start that. I even do foot exams and make sure that their sensation is okay. I can refer to a podiatrist if needed. I can refer to any other specialist. So we do blood work on like kidney function, and if we see any issues there, then we refer to nephrology and we make sure that the care team is well rounded and make sure that patients are seeing the specialists that they need to see based on blood work. We normally see patients every 3 months because unless their A1C is coming down, they're doing well, then sometimes I extend it to like every 6 months, but usually every 3 months we're seeing the patients, so it helps with accountability and making sure that that A1C is coming down. And again, a lot of primary care providers don't necessarily have the time to see patients that frequently, so that's one benefit. And then we also have other resources in our office that can really help patients get this under control.
Okay. Well, good to know. Now I have a question. I hear sometimes, pretty often, when people are curious about CGM, continuous glucose monitors, and they say, "How do you get it?" I've heard multiple times that go to your endocrinologist and ask. because they have it in the drawer, just the trial version. You could they could give it to you even just to learn what you are doing. Is it truth or it's not true?
So it really depends on the practice. Some
Uh-huh.
practices do get sample continuous glucose monitors,
Yes.
so you're able to put one on in the office. At my previous adult practice, we did get samples of the continuous glucose monitors, so we were able
Uh-huh.
to start them on one. That may not be the case for everybody. They may not be able to get samples depending on the location, but yeah, some endocrinologist offices do have samples to start on, and then ask even primary care provider, ask the primary care provider, your endocrinologist, to send in a prescription for a continuous glucose monitor. It is such a helpful tool, and you
Yes.
don't know if insurance is going to cover it or not until you really send it in. So I always recommend having a prescription sent in just to see if insurance covers it. If it doesn't cover it, there are also over the counter continuous glucose monitors that are not FDA approved for patients who are on insulin, but if you want to see what your blood sugars are doing, you can purchase those over the counter.
Okay. Yeah, well, this is something that we keep talking, and I tend to believe that this is such a great tool available
Hmm.
to people, and it not necessarily, I'm not saying that everybody has to wear it all the time, but I
Hmm.
think everybody who has diabetes should wear it for sometimes, maybe for 1 month, just
Yeah,
to learn how your body responds to different triggers, right?
yeah.
What people can learn from CGMs?
Yeah, so a blood sugar poke is just one snapshot of the picture. So when you poke your finger with a glucometer and test your blood sugar with the glucometer, it's just giving you one pinpoint of the data. Whereas continuous glucose monitor gives you the whole picture. So you're able to see the peaks and the valleys of your blood sugar trends. So I think it's so helpful because you could test your blood sugar 2 hours after a meal and it could be fine. But if you see that your spike it's going up into the 200s and then it comes back down, so there's obviously some insulin resistance going on there. You're able to see the drops in blood sugar. If you're having lows after a spike, it could be related to something called reactive hypoglycemia, where you're eating a significant amount of carbs and then your body just pumps out a bunch of insulin and then you have a low blood sugar. So you're able to see a lot more, a broader picture with a continuous glucose monitor. I highly recommend anyone who, even if you're pre-diabetic or suspect you have insulin resistance, it's such a good tool to see how your blood sugars are doing.
Mhm.
I personally had gestational diabetes with two of my pregnancies, both my pregnancies. And so I will wear a continuous glucose monitor every once in a while. Luckily, my A1C has remained normal after my pregnancy, but I still like to see what my blood sugars are doing. And it's really helpful for me because I do feel like I have some sort of insulin resistance, and I
Mm.
see the spikes after a more carb heavy meal that I'm eating. And I'm able to see what foods do to my body. And I think that is so helpful for everybody to know and to understand because every food is different with different bodies. So
Mhm.
rice may spike someone, and rice may be totally fine with another person. Or pairing rice with a fat or carb, or pairing these carbs with protein or fat can help, and you're able to see that response by wearing a
Yeah,
continuous glucose monitor.
absolutely. This is you just when you were describing this, the difference between the just finger poke and continuous glucose monitor, I analogy came to my mind. It's like taking a picture or taking a
Mhm.
video. We see
Yes.
the picture, somebody is smiling and, hands up and everything, and they're on top of, I don't know, of the wave. But if you do the video, you see that the very next moment after this picture, that person crashed, and it was
Mhm.
not such a pretty picture. That's probably the same thing that we could observe with the blood sugar levels. So it may be perfect at the moment when you poke it, but the very next 10 minutes, something may happen and you maybe have the tremendous drop or scary rise. And we don't know
Mhm.
it if we don't poke ourselves continuously, right?
Exactly. Yeah. Yep, exactly. It's such a great tool. You're able to see so much more with it.
Yes, definitely. All right. So one more question before, unfortunately, we have to kind of start wrapping up. Uh, One more question I have. A lot of times people, I hear all the podcasts and everything, and you mentioned it already a couple of times about insulin resistance. Is it a common test? Do you do the to test the insulin levels for people when they come to you to the endocrinologist office, or it's a specific request, or it's related somehow with insurance, because it's not that common to discuss the insulin levels. It's more common to guess. You probably have insulin resistance, but is there some definite data about it, and how endocrinologists are, working with that? If it's often used as a piece of data, or it's not that common?
Yeah, so as an endocrinologist at my practice, we would test every new patient that we had coming in that had diabetes. We would test them um, for insulin antibodies. We would test them for insulin levels, C peptide, which tells us how well the pancreas is producing insulin. So we would test all of those things at their initial appointment. It's
Hmm.
not necessarily anything that we follow regularly unless we're seeing a progression in the disease. But unfortunately, sometimes the insulin levels can be normal and you're still having these spikes and lows and having insulin resistance. So we do the tests and we use them as a point of data, but it doesn't always give you uh, the diagnosis
Oh,
necessarily.
yeah.
It's a lot of it is based on the continuous glucose monitors, based on your A1C, based on what symptoms you're experiencing, and it's a clinical picture on top of the data.
So basically you're saying that this is part of the general diagnosis. It's not
Mhm.
the diagnoses are not based on it, because you see
Yes.
also sometimes they say that your blood sugar levels and everything could look perfectly fine, but if you test your insulin levels, you can learn that you already have problems there, which means you have to be more careful because you will get the diagnosis of diabetes in the future if you do not change it. So it's kind of like a marker indicating
Yeah,
that there is a
possibly.
possibility,
Mhm.
but not necessarily the suggestion that you have it.
Exactly. Yeah, if your insulin levels are elevated, then that's a sure sign that you do have insulin resistance. But I've had people who have had normal insulin levels, and I still suspect insulin resistance, especially
Mhm.
based on the rises in their continuous glucose monitor data, and based on their symptoms. Like if you're struggling with losing weight, a lot of that is related to insulin resistance too. So, yeah, it's one part of the data, but we use the whole clinical picture as well as these lab tests to diagnose.
Absolutely. Okay. Last question. I promise. This is the last question. Uh, so, a lot of people who got diagnosed with type 2 diabetes, they refuse to start taking any kind of medication, especially insulin, because they believe that once they started, this is for the rest of their lives, and they don't want to be people who have to do this for the rest of their lives. Is it truth, or this is a myth that people should know more about?
No, that is a myth. We have started patients on medications and have been able to wean off as their lifestyle improves. So, with this diagnosis, if you leave it untreated for so long, then your pancreas is going to get injured. The blood sugar um, affects the pancreas, it affects the cells in the pancreas. And so, the longer you have untreated diabetes, the worse shape your pancreas is going to be in. So if you
Mm-hmm.
have a super high A1C, like say it's above 12%, we often start patients on insulin to give the pancreas a rest
Uh-huh.
and to bring everything down. And it helps make people feel better overall. And as they start improving their lifestyle and eating better, exercising, then we can always wean off of it. And a lot of people just have this stigma behind medications
Yes.
and that they're failing if they have to be on medication for this. But there are so many great medication options out there for diabetes, and it also helps um, essentially helps with other complications of the diagnosis. So some of these
Mhm.
medications also protect the kidneys or the heart. So they have so many benefits. Yeah, some of the side effects can sound scary, but most of the time my patients tolerate the medications just fine. And I do warn people of the side effects, and if they start having side effects, then we try something different. But it is there's so many great options out there, and I don't want people to be afraid of those options. It's always something that you can come off of potentially in the future if your pancreas is able to produce insulin and to utilize that insulin appropriately. Then it is something that we could potentially wean off of as lifestyle improves. So it's not a life sentence of medication if you implement other strategies as well.
Absolutely. I always say that you got to be active participant in your own
Hmm.
health. If you
Yes.
only rely on doctors and medication, then and don't take part in it, don't help, then eventually medication weakens out, your body gets used to it. You have to either increase the dose or move to the stronger medication. But if you
Hmm.
actually helping your body, you can eventually to at least lower the dose, but
Yeah.
maybe even get take this off as long as you continue those changes, positive activities that you adopting, and it's in my belief is that when you doing that, you're helping others to see
Hmm.
that this is possible. Maybe your family will adopt your new healthier lifestyle, and they will
Yeah.
avoid this in the future, like completely. They will not have to have a challenge to fight with. They just will live the
Hmm.
life, the active life that they used to, right?
Yeah, absolutely.
Well, Chelsea, thank you very much for this conversation. I need to make a couple announcements. So one more time, please tell us real brief how people can reach out to you if they want to hear from you more, if they want to speak with you, how they can find you. Where is the best?
Yeah, so I am on Instagram and Facebook. My handle is empowered glucose. And I also just launched my website. It is www.empoweredglucose.com. And then I also have an email, Chelsea@empoweredglucose.com. So you can reach me any of those ways. I will be available and I can help with the diagnosis, help educate, and provide any resources that you wish to have.
Perfect, perfect. Thank you very much. So, and as I would like to remind people about a couple of things that first of all, for those who is new to our podcast and new to our Facebook group, Diabetes 101 for Beginners, I wanted to let you know that every other Wednesday we have our support group meetings where we meet with our group members, experts, in who are helping people to work with their diagnosis. So join us there. This is Zoom. This is not in Facebook. It's outside of the Facebook world, and it's usually pretty cozy group. Not a lot of people there because it's evening, 7 p.m. Eastern on a Wednesday weekday. But join us there. If you need support, if you need help, please do that. Again, our podcast is always going at 4 p.m. Eastern Time on Thursdays. These are new episodes being launched. But if you missed some, you please go to YouTube. And on YouTube, you could find this our channel called Smart Move 360. Podcast is called Diabetically Speaking with Smart Move 360, and you could see more episodes that we recorded in the last 3 years. On Saturdays, actually, we not every Saturday, once a month, we have our Diabetes 101 for caregivers. This is our 2 hours crash course that Kim Kyle, registered dietitian, and myself, we are organizing for people who, first of all, helping those who are diagnosed, but also for those who were diagnosed and um, didn't quite understand what their diagnosis is. We don't do like a blanket course altogether. We are focusing on one specific topic every time. So we had uh, one day we had the medication for diabetes information. Another, we had what is A1C and why it's important to look at it. We looked at the how to read your labels when you go shopping, or what snacks are good for you. These are all different presentations that Kim prepares for us, and I invite you on the same channel, Smart Move 360. Just look for the playlist Diabetes 101 for Caregivers. One last, most exciting to me announcement is that my app, Diabetes 101, is launched. It's available for download on Apple Store or Google Play, and everybody is welcome to download it. Right now, it's a very limited information there because I just launched it. But we are speaking with people like Chelsea, with Kim, with Trevor Brown. Everyone potentially will have their own sub app inside of this app. So every time when we have somebody new coming with their help and services, we also will have a marketplace there. So you could buy some goodies there that may help you to manage your diagnosis. So all this is coming for you. All you need to do to download it and put the notification on. So when something new coming up, you will be first to know about it. With that, I am wrapping up today. Chelsea, so great to have you here. Thank you very much for this information you provided. I think this is such an important piece of information that a lot of times people are missing. And I've heard the conversations that people would have with their primary doctor, and they say, "Why don't you send me to endocrinologist?" And primary care will take it almost like, uh, are you saying that I'm not managing you well? I can do it. So this is not a
Mhm.
challenge. Please believe me, this is not a challenge. This is help. This is
Hmm.
something that you can help yourself and you can help your primary care to help you more effectively. So please use this information, share this information with people who you think may benefit from knowing it. If you're on YouTube, if you're watching it on YouTube, please like this video. Please share it with those who may benefit from it. And we will be preparing the next episode and launch it next week. Thank you
Awesome.
very
Thank you so much. Thanks for having me.
much. Okay, thank you. And everyone, see you next week.